everyone. Amy Wood with Dr. Cedrek McFadden as we discuss something other than COVID-19. There are some other health issues that we need to think about this time of the year especially. And today we're going to focus in on Lyme disease. So what is it, Dr. C?
Lyme disease is an illness that people get from tick bites. And these ticks attach to you as you walk through tall grass or shrubs. They don't jump or they don't fly, but they can attach themselves to you and they can transfer the germ that causes the Lyme disease to you. The Lyme disease is not contagious. You don't spread it from person to person. And if you can remove the tick for a day and a half, you're less likely to be infected with Lyme disease.
You know, a lot of people probably suspect that, hey, I'm not a hiker, I don't go through the woods. I might not ever encounter this, but it doesn't necessarily mean you have to be out there in the woods hiking to have Lyme disease impact your life.
No, I mean, you could be in endemic areas. You can be in areas where you're just walking, again, through tall grass, whether it's in your backyard, especially if there are mice or there are deer or other animals that carry the Lyme disease. It can actually still affect you if these ticks are in the area and then attach themselves to you.
And how common is it?
So the CDC estimates that over 300,000 cases are present each year. It's most commonly present in the Northeast or Pacific coastal regions, but Lyme disease is present in South Carolina, and it's generally present in the spring and in the summer months, exactly where we are right now.
So you've sent a picture, I want to put this up on the screen, of someone with something looking a little unusual. This doesn't look like a normal arm or leg that we're looking at here. What has happened, and is this a sign of Lyme disease?
It is a sign. It's a very classic sign. Most people think it looks like a target or a bullseye. It's one of the earlier manifestations of Lyme disease, but there are others. This particular one can be present, again, within days or weeks of the tick bite, and it can grow larger, it can be warm to touch, it can be actually very painful. But there are other signs, whether it be fever, stiff neck, joint pain. There can also be heart problems, such as slowed heart rate. In the longer term, even months to years later, if not treated, Lyme disease can cause other problems such as arthritis or joint pain, or even neurologic problems, trouble with memory, or even facial nerve weaknesses. So again, it can be quite drastic, and again, it can go undiagnosed and can produce symptoms years to months later.
Is there a test for it?
So there is a blood test that you can do for Lyme disease. It's not always gotten because, again, if you have the early sign of this rash present, the doctor may not need to have the blood test. And it can take some days for that test to come back as being positive. So you want to talk with your doctor, and if that conversation seems like you were bitten by a tick and you are suspicious of that, they may start you on antibiotics that can take care of the problems quicker, or certainly within a reasonable amount of time.
Of course, a lot of us like to prevent things from happening. So when it comes to
Yes.
preventing Lyme disease, what kind of steps do we all need to take to really avoid this whole problem?
So prevention is your best defense. So if you're going out wearing a repellent, keeping long sleeves, long pants, before you come in the home, perhaps consider taking those clothes off. And certainly if you're going out, have clothes that are lighter colored so that you can see these ticks, which may be no bigger than a poppy seed. Coming into the home, taking a shower within 2 hours, checking the most common areas such as the scalp, the under the arms, the waist, behind the knee, those the groin, checking yourself and also children, because again, if you can remove the tick within a day and a half, again, you can prevent Lyme disease. And so making sure that you remove a tick if you see it with tweezers very slowly, and if you can't remove the tick, you need to call your doctor sooner than later so that it can be removed and perhaps be considered for a treatment with antibiotics.
Dr. Cedrek McFadden, thank you so much.
Thank you.